You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co host, we interview the innovators in this space every week. Ivan, go ahead and get us started.
Yeah, I'm Zach. Really excited to introduce a colleague of mine, Dr. Dennis Chmiel. Dr. Dennis is a co founder and chief laboratory officer of MySimplePetLab, an animal health technology company specializing in at home vet approved tests and care. With a background in marketing at Zoetis Pet Care, he led successful product launches and developed health risk assessment for pets. Prior to his industry roles, he practiced small animal veterinary medicine for 13 years and holds a DVM from Tufts University. Dr. Schmil's experience encompasses veterinary business, marketing, and pet wellness, making him a recognized speaker and leader in the field. Dennis, welcome to the show. Thank you for finding the time.
Thanks so much for having me. I'm excited to talk to you both today.
Quite a pleasure. Tell us about My Simple Pet Lab. What do you guys produce? What are those diagnostics? And how do pet owners decide to do those diagnostics at home?
Yeah, we were founded back in 2019. I co-founded My Simple Pet Lab with Dr. Nancy Willerton. The two of us combined had 50 plus years of clinical and animal health industry experience. And we just became obsessed with this growing veterinary access to care gap and came to believe that home test and care options, solutions would be a necessary aspect of trying to solve that gap. And so ultimately led to My Simple Pet Lab and the solutions that we've brought to market, which include both diagnostics from home, so test options, and care options, so just in time care kits for conditions like diarrhea, skin and itch, first aid, and ear infections. And we believed, even back then, that we could not only use test and care in the home environment to help with access to pet parents that just literally didn't have access to veterinarians in a reasonable distance or time or from an affordability standpoint. But also, we believe that we could integrate those test and care solutions into the veterinary healthcare delivery and business models. And that's what we're really doing today, both putting these test and care options direct to consumer and wholesaling those test and care products into the veterinary practices for their use with their clients.
Super cool. The just in time care for diarrhea is interesting. It makes me think of a story, Dr. Dennis. So, my
Ah,
brother
do tell.
has has a couple of boxers, and a hot summer day here in Nova Scotia, he had put a baby gate up so that they were kind of in the hallway where the floor was hardwood so they could stay cool during the day and go out on the deck. And they had a fan there as well for them. And the dog came in and was in that area. And my brother came home to the day the shit actually hit the fan because the dog had backed up and had diarrhea over the fan. And it was all over the window, all over the windows, all over the walls, over the ceiling. So I never thought I'd get to tell that story on the show, but that was the day the shit hit the fan for my brother. So it's kind of funny and very interesting that you
All
talk
right.
about just in time because I don't know how that would have worked. But still kind of an interesting and kind of funny story. I think this is a really interesting idea that you guys are doing here. What you're up to is very interesting. Everybody that listens to our shows knows that there's more pets than there was 4 years ago, and there's not enough pets to go around. What is the kind of key kind of solve there? What's the biggest thing that's moving the needle forward to kind of help with this industry-wide shortage of veterinarians? And why do you think you guys are going to be successful at this?
Yeah, as you know, there's a lot of factors that are leading to the access gap, right? Everything from workforce shortages to a plethora of operational inefficiencies, in clinic. We've taken a lot of, practices that worked well in the 60s and 70s and 80s and are still using them today. Like a great example being that, we try once a year to download and do everything that pet needs in one visit, right? Or maybe two visits. And that's just like not possible anymore. And I think one of the ways that we really fit in, I think, in that regard is really thinking about today, for veterinarians, like what is necessary to do patient side? Like what is critical, crucial, like you have to do with the pet in front of you? And what are some of those things that don't have to be done in that moment? They could be done or better done in advance of the visit or better done after the visit. Like a great example, like in human healthcare, right, is, many human doctors now want you to have your blood work done before you go in for your annual visit, right? Because they don't want to speculate. She doesn't want to speculate, your doctor, on what you may or may not have, like in your blood work. She wants the blood work there at the time of the visit. And so I think there's opportunities to start getting some testing done, in advance of the visit. And so we're working with the industry in that regard. Fecal samples, right, are an easy example there. But also on the backside, there's opportunities to think about the recheck journeys differently, right? There's very, there's a limited, with most practices nowadays, there's limited appointment slots, and veterinarians really have to think about how to prioritize those slots. And recheck exams are arguably the really the lowest priority visit in most cases. I think we could maybe argue that 75% or so of recheck visits are in that sort of nice to have versus must have category. And those are also the most canceled. They're the most missed appointment slots. And they're the ones that are also often the most difficult to drive customer value, client value for, right? So, and they're the lowest revenue appointments. It'd be better to save those slots if you can and convert them to wellness visits or primary illness visits. And so that's another area that we're helping with operational efficiency in creating better vet visits is wholesaling these test kits. And this is what they look like. These are what we call soft test kits for the veterinarian. And veterinarians will have these test kits for GI, for ear, for skin, and they'll sell the test kit to the client at the time of the initial visit. That client will take it home with a date for when they need to do the recheck from home. They'll send the sample to our lab in Denver, and we'll auto share results back to the veterinarian and to the client in ways that they both can understand. And then that veterinary team will make a decision whether or not that pet needs to come back in. And it's a great experience for clients. It's uber convenient for them. It's low stress for pets, and there's a real business argument for it as well on the veterinary side.
That's really cool. I'm on your website and looking at different kits, and I'm now exploring a couple of shifts a week in ER again, and it's just a wonderful experience remembering how this works. And if every client came in after they did their own poop test, we don't do them in ER. So anything they want to do at home to test for anything fecal, because we do have a fecal test in ER, and technicians kill me when I submit one. So, and
Right.
yeah.
Yeah, there's that aspect of it where if you ask technicians, like, what are their favorite things to do, like fecal testing or handling a fecal sample, right, is not on the top of the list. It's always like, toward the bottom.
Which is definitely not surprising. So the one, this is a maybe a controversial question. So I think any innovation, I always welcome it, but that's just me, right? And totally see how you're explaining it. I think having that at home again, I'm thinking through the ER window, sending home and being like, hey, next time this happens, you can test for this. It's a product, you can sell it. It's like it's sold by veterinarian. I would, I would have your product in my emergency hospital where I could just send people home and say, hey, test for these things first so you don't have to pay, exorbitant ER fee just to come in for, diarrhea. But I also see the other side of those that demonize you and think that you're like you're coming from Chewy and or something like that, stealing our bread. And then, so how much do you get of that where veterinarians like, this is ridiculous. This is, customers or, parents should not test things at home. They should only see a vet. So how much of that pushback are you getting? And are you able to handle it and kind of convert people?
Yeah, it's a great question, and it was something that Nancy and I worried a lot about before we launched. It was, what is the pushback going to look like? Because, when it comes to business model innovation, like our industry has not always been, as progressive as I think some of us would have liked. And the reality is that we've had very limited pushback, and when we do get a veterinarian that has a question, we talk to them, and if they're willing, and it's usually like an easy understanding, of what we do. And I think, coming out of COVID too, like we found as a startup, we found COVID was a headwind because it was just hard to get something going, like as COVID came underway. But and before COVID, it was really common for both veterinarians and even some pet parents to be confused as to what we were and what we were doing, right? This sort of thing just didn't exist before. We were first to market bringing fecal samples and ear cytologies and skin cytology testing, from the home environment. But COVID really offered the silver lining for us out of COVID was it did provide a lot of tailwinds, and that it helped people understand that testing can be done. Certain tests can be done countertop, like at home, and you get the results right there, like COVID antigen testing. And certain tests can be done from home, so COVID PCR testing. And it's suddenly like everyone started to understand that, oh my gosh, like we can do this. And in human healthcare, right, this sort of home testing care options are becoming increasingly normalized, right? From, it started with Ancestry and then 23andMe, and fast forward to today, and Everlywell, Cologuard, Eucora, right, for UTIs. Like these things are starting to just become a normal part of human healthcare, and we're really helping to, I think, drive that on the animal health side, really trying to lead that. And as we engage with veterinarians, that they're, I think, really starting to understand that they can't see everyone and they have to offer solutions, right? It's a pain point for veterinarians to have to tell a pet parent that they can't see a dog with an ear infection for 3 to 5 days or a week or 2 weeks, right? Or they can't see a dog with diarrhea for that same amount of time. And they're starting to, I think, really recognize that they're putting those pet parents, like, one, that the dog may be suffering, that pet parent has anxiety associated with that, and there's limited options right now for those veterinarians. And we're having practices call us. We just literally launched care kits this summer, but like this is like an example of the diarrhea care kit. And it has probiotic chews in it. It's got fiber chews in it. It has kaolin pectin in it. So it's got these things which are, I think we'd all argue are uber safe, and in combination have a good likelihood of being very effective. And it also comes with education that veterinarians would find appropriate for how to feed a dog, what the signs to watch out for, when it is appropriate to go to the emergency clinic. But if we can use these things through veterinarians and make access to them through companies like partnerships like Target, we can maybe prevent a lot of those dogs from ending up in situations where they have to go to the ER because they can't get to their primary vet. Or once they're at the primary vet, now the vet can adjust the treatment, based on, how that dog, is doing. So I think that the industry is changing, especially the younger generations of veterinarians. And I think COVID has really forced the industry to think differently about how to deliver healthcare, and really being much more open-minded to test and care opportunities from the home environment that can bridge back to the veterinarian.
Yeah, fascinating. Really, really interesting. The question that I had is, we have a lot of independent practice owners, a lot of groups that listen to our show, and so I would like to dive into how these products get integrated into the daily veterinary kind of customer life cycle, and what the revenue models look like, and just if somebody's interested in starting to do that right away, what the benefits are, and just to talk about your product in terms of what's in it for the veterinarians and the independents and the corporate groups, because you're talking to a lot of them right here. And once, I also want to say that it's incredibly innovative, and I think that the solutions to get out of the problems that are in the industry are multifaceted, and I think
Yes.
that this is one great solution. So talk to our people here, Dr. Dennis.
Okay, very good. Well, maybe I'll use it as I'll take the opportunity to use a journey, an example,
Start
and
with the dog shitting the fan.
that's right.
Because nobody wants
So
to clean that up.
that's right. That's right. So, in that situation, and probably, I don't know what day of the week that happened, but generally speaking, that was probably a Friday night, right? When it happened. And what What we hope to do, like in that situation, is really like the just-in-time like solution. So, a pet parent that can easily access a diarrhea care kit, and and I should mention too that there's a big movement, right, that started in Europe and now in the U.S. about moving away from antibiotics for diarrhea, and we think that the care kit bundles are an opportunity to help support that, but literally, veterinarians can wholesale purchase these care kits from us and sell them with margin in their practice. If they choose to. That's not something that's been available before. But these sort of first response, just in time care kits for diarrhea. Ear infections, skin and itch, and first aid. And the way in which they should be used is as a stopgap, as a temporary solution to help that pet owner deal with the pain, the potential suffering that pet is going through, or for the dog with the diarrhea that you mentioned, try to get that under control until they can get in, to the veterinarian. But on the test side, so the easiest way in, I think that we've seen for veterinarians to start to engage on the test side, to integrate that into their healthcare delivery and business model, is really in the recheck journey, to have really a best-in-class recheck journey, which is more convenient for the client, less stress for the pet, and a smarter business and revenue opportunity for the practice, and to free up slots for other appointments that can generate more revenue, and be potentially more valuable, like initial wellness appointments and initial illness appointments. So on the recheck journey, what a practice does is they just wholesale purchase test kits, and so they get boxes of test kits. And let's take the journey of an ear infection. A dog comes in for an ear infection, and the veterinarian does what the veterinarian normally does. They take a swab, they look at it under the microscope, determine if there's yeast or bacteria, cocci rods, and then select a treatment. When that pet goes home, they send home the test kit with the treatment, or with that owner. Say they've done like a Claro, where it's a long-term treatment. The pet parents maybe not putting something in, or maybe they are, but the veterinarian will determine, the veterinary team will determine the time point with which that pet parent should do the recheck cytology from home. And so, say 2 weeks later or 4 weeks later, the pet parent opens up the kit, activates the test online. There's easy to understand instructions on how to swab a dog's ear safely to get a high quality sample. That sample is dropped in the mail, sent to our lab, and we auto share results back with the veterinary team and client. Now, the practice, generally what they do is they will charge for the test kit and the virtual consultation simultaneously. So they charge for it at that initial visit. And so it's already paid for. And then at the time of the consult, when the ear results are back, they make a determination based on symptoms and the test results whether or not that pet needs to be prioritized to come back in. And generally speaking, what we see from working with practices is they'll prioritize about 20% of those patients to come back in for recheck visits, and about 80% will stay home. They may still need additional medication or flushes or additional guidance, but they'll free up those slots for other appointments.
And that revenue up front, how beautiful. That's a beautiful thing.
Yeah, and clients love it. We do surveys with vet teams. We do surveys with veterinary clients, with the practice's permission. And these are like 9 out of 10, 10 out of 10 surveys. Like, clients just love the convenience of it. And if they get results back and the veterinarian says, okay, like, yeah, you need to bring the dog back in or bring the kitty back in, the client's like, okay, like, there's evidence to say I need to come back in. Like, I need to make this happen, versus like the veterinarian just like, it's just out of a routine making me come back in. I don't see any symptoms. Like, why am I doing this? Why am I taking time off work? Why am I fighting traffic? Why am I putting my dog back in the car and waiting in the waiting room? Like, all that, right?
That's brilliant. No, I love that. And it's almost like lots of rechecks are not monetized. Like a lot of people hate them because you just book them to see them again, and especially if it's all normal, you're like, all right, cool, that's all fine. So I love the fact
Right.
that you can actually monetize the recheck, which a lot of vets don't do that. And there's a tangible product that is attached to it too. So you're like sending them with it, and that's incorporated in the price. So love all of this. Are you in Canada? That's I'm almost like thinking, hey, I would love to have that in in our practices, but
We're not in Canada yet,
okay,
but
we're not going to produce this
give us time.
episode.
Give us
That's
time.
it. This episode is not going to be aired
It's
anymore.
over.
I
Canceled.
know.
You've just
I
been
know.
canceled in Canada.
Oh man, didn't
No,
even
but
make
we
it
would
there.
love
No,
you
yeah,
to go to
canceled.
market here. That's all it is. So the huge compliments to you. Unfortunately, we ran out of time as we do. And we always have two questions at the end of the show. One of them is there a TED Talk, YouTube video, book, or podcast that inspired you recently?
I'd suggest for all the animal health listeners, Crystal Stokes podcast. I've become a super fan recently, and she talks about veterinary leadership and well-being. And Ivan, I know you've been on that podcast, and it's a great podcast to listen to. You also your foundation has been on that podcast as well. So I would strongly encourage that you're finding that on your podcast or adding that to your podcast library.
Awesome. And then the last question for you is another innovator that you think we should have on the show.
Yeah, I'd encourage you to reach out to Mark Cushing. He is, one of the founders of the Veterinary Virtual Care Association, and we just sponsored some podcasts short podcasts that he did through VCA, giving updates on veterinary telehealth in the U.S. Some really great, short podcasts, but he's connector and goes through all levels of the industry. He, from nonprofits to for profits, and is very involved in legislation. So I think he'd be a really interesting person to have, on your show.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinarynnovationpodcast.com. See you next week.